Hi, everyone. My name is John Faulkner, and I'm the host of the Smarter Systems, Better Care podcast. And here with me today is Dr. Kian Modanlou. He is the co-founder and managing principal of ProviderOne Solutions. This is a physician-founded Locum Tenens company focused on delivering strategic solutions for healthcare systems and providers. Thank you for joining us today, Dr. Modanlou. How are you?
Great. Thank you for having me.
Absolutely. Let's kind of jump right into it. Can you tell us a bit about your background, kind of like your business model and the clients that you serve?
Well, first and foremost, I'm a physician, surgeon. I originally trained in solid organ transplant and did that for 12 years and kind of took a step back, went to general surgery and private practice and really came to this idea. We're in a pretty tough market in Denver, Colorado. Some of my partners in private practice started to do locum tenens. And number one, really enjoyed it. Number two, we're making better money. And we kind of decided that we needed to do something. We thought, why not start our own company and do this? And thinking that we could find our own niche in this industry. And so three of us came together and started this about 2 years ago. And it's been slow going because we all still have full-time jobs and have hired some people to help us, which has been nice. But really what we're focusing on is a different system of healthcare that we're looking to provide physicians with different opportunities, not just pure locums, sometimes a hybrid practice to augment what they're already doing, as well as help these health systems to kind of figure out where are their gaps and why are they having these issues. I think this is becoming more important. Most of the data that I've seen is estimating even by 2030, tens of thousands shortage of physicians in the workforce. As we've already seen, some of that, especially in primary care, will be made up with the advanced practice providers such as, nurse practitioners, physician's assistants. But in some of the more specialized care, surgical care, some of the subspecialties, we're still going to need physicians. And I think it's not a panacea, but looking at locums, especially when you have a hybrid practice where you still have a private practice where you primarily live and then you spend some time every month away is, the term we've used is for physician arbitrage. We're looking for places where physicians are needed more, can make more money, and really contribute to the delivery of healthcare.
Absolutely. And it's more than just filling in a gap or trying to get heavily involved in that practice or that group to help them solve the source of the problem, it sounds like, too, in a way.
I think, again, we've seen, in at least in my lifetime, since I was a kid, we haven't seen inflation like this. And, especially for the private practice physicians, that's, where my heart is. And it's becoming, every year our rent's coming up, the cost of employees, benefits, everything, while reimbursement is coming down. And even yesterday, there's hints from CMS that they're thinking, especially as far as procedures go, that they want to do a 2.5% cut across the board. So it's becoming harder and harder. And I think it's very important to have physicians independent, from both insurance companies and health systems. I think there's a benefit to that, to remain independent. And so anything that we can do to help groups stay independent, I think there's been a slowdown, but we've seen, earlier in the decade, private equity buying up a lot of groups. From the people I know that have sold out to private equity, it hasn't worked out well for them in the long run. A lot of people aren't happy. And so I think that this industry needs some people that, are not just filling positions when there's need, but helping to figure out a better system that can, keep our healthcare system sustainable. I think some of the data I've seen is that in about 2/3 of the states, healthcare is the largest employer, even more so than manufacturing. And so, the health of the healthcare system economically is going to be very important, to the economy of this country. And, figuring how to deliver care is going to be, effectively and maintain access, and the health of our population is going to be very important to keep us competitive economically in the world.
Yeah, absolutely. And if you were talking to a private group who potentially was engaging with you and maybe thinking about working with you, like what would be your competitive edge you can tell them within 30 seconds? Like what's a quick pitch you would say?
I speak your language. That'd be the simple thing. I'm not a sales guy. Again, I'm not here for, trying to make a commission. That we want to find, and I don't want you to work with me unless it makes sense for you. It's an advantage. We've seen, especially since COVID, physicians retiring early. A lot of them, this term burnout, moral injury, just the stress of everything. And, I think we saw it earlier with the nurses during COVID. And I think we're after COVID, the physicians were, sort of lagging behind, but we're seeing it now where, physicians, you know, when they're unhappy, a happy physician is a much more productive physician. I think when you feel like you're well compensated, you provide better care, it's better for everyone. And
Absolutely.
so, finding something that works, for someone. And that's what we want to do is find something that fits into their goals that can help them and really what we want. So I do locums myself and I was, to be honest with you, quite surprised. To be honest with you, at first I was like, well, this is a way to make, better money than taking call locally. But what I've found, it's been very rewarding. I work out at a rural hospital, not a critical access hospital, but a rural hospital. But not to sound too cliched, but we've experienced kind of like this Doc Hollywood type, moment where you have the big city surgeon that goes to this rural community, and we really bonded with the people that work at the hospital, and unlike a big city where everybody's unhappy and thinks they're not paid enough, these people, it's a different attitude. They're part of that community, a lot of them, and the patients that they're taking care of, they know, right? That, when I operate on someone, they're like, oh, that's our pharmacist mom, or, oh, this guy, he sells real estate and I bought my house from him. So there's all of these stories. And so it's been, and the patients have been, so amazing and so gracious to us, all the time we get this, oh, just, thank you for being here. Thank you for being here and providing the care in our community. And so, that's the kind of thing that we're trying to do. I think the perception of locums has changed, in the last 10 years. If you had asked me 10 years ago, hey, would you do locums? I'd probably give you a weird look and be like, hey, that's for people who don't, can't find a job or between
Yeah.
jobs. What we've really seen is we're shifting this paradigm to these are some of the better physicians. These are some of the smarter physicians who have figured it out that want to enjoy, a work-life balance, which is hard in a traditional practice. It's hard when you're employed and you work for someone who's telling you what to do. You have much more autonomy and control about when you work, when you don't work, and can more, I think, align your financial goals with your practice and, end up where you want to be. And again, what we've seen too is that the cost of looking at two different, like a bimodal distribution of, our clients, that when you look at the young people coming out of medical school, right, the cost of higher education has increased 700% from when I went to medical school. And, again, with the new bill that was passed, you're going to have caps on federal loans, which, we have a lot. I train residents in general surgery. And what I see is a lot of my residents come out of this whole process $400,000 in debt. And that's a mortgage,
Yep.
for a
Wow.
house that you don't have. And so, for some of them, it will be important to make money, while still doing what they love and fulfilling why they went into medicine. And I think this kind of helps them. Either they do this, full time, they do this on the side. They can help to kind of pay down that debt and create wealth like people in other industries. Because when you look at it, they're starting so far behind with, after 4 years of college, 4 years of medical school, and at least 3 years of training. You're not really making a salary until, you're in your late 20s, early 30s.
Yeah.
And that puts you, very, very far behind your peers who at age 22 started to save for retirement, started to make a decent salary and move up the ladder. So the other thing that we've seen this, part of when you look at general surgery, 1/4 of general surgeons are age 60 or older. So you're looking at a workforce that may start to retire. And again, as you get older, again, John, I'm older than you, it gets harder and harder, to stay up all night, to have a very robust practice. And so I think locums, we're looking at this 50 plus group, even the 60 plus group as giving them an option to work part-time, into retirement and not just say, hey, I can't do 100% anymore. This is burning me out. That, hey, maybe I can work half-time,
Yeah.
still make a good salary, have that extra time to spend with, kids, grandkids, spouse, and, kind of, ease off into the sunset instead of just kind of, hey, I'm done, with this and, kind of be and working hard, very bitter, but, hey, this is a different way. You know what? I can take a month off and, take my spouse on a trip, outside the country, something you can't do in a traditional practice. Again, private practice, I couldn't imagine, taking a month off, the financial implications to me, to my patients and continuity of care. But I think locums offers you, a lot of these opportunities that you can't get in a traditional practice.
Yeah, absolutely. And as far as like bigger picture, kind of talked to about already, but the kind of like the shift, what's like the one shift in the industry here with locum tenens that you think like most founders, operators, or owners are underestimating? Because I'm sure there's other people kind of, there's definitely like other companies that are doing locum tenens, but what are things that they may be underestimating in the space?
Well, I think that you have to be more than just someone who fills, a spot. A locum tenens is Latin for to hold a place. And so I think that if, companies are focusing on just filling a spot, and which is just kind of, you're not helping this health system to figure out a better way to do things. I don't think you bring a lot of value, because locums is expensive for the health systems, right? Versus hiring someone, but possibly coming up with a solution that's going to work. So I'll give you an example. We're up at this rural hospital in Colorado. We walked into a place where they had two surgeons who were underperforming, and one of them was older and, wasn't interested in building a program. The other, and so what we brought there is, we said, we're not going to hold the pager and take ER consults. We are, we'll do clinic, we'll help you build a program. All three of us are highly trained robotic surgeons. I said, we need to introduce robotic surgery to this community. That's something that they're not there. I said, help us, we're working with the health system, with the company that builds the robots to, get a robot in there. And I said, if we can build up a program, that we have three of us in this rotation that are augmenting, their one employed surgeon, and really make the financial health of this hospital so much better. It's also going to create a very attractive practice to hire someone, a young woman, young man who wants to come, move their family, live there live there, practice there 20, 30, 40 years. And it's right now, it's not something that someone would jump into. And especially a young person who doesn't have a lot of experience, I've been involved in building several different programs at different hospitals, and that's a skill set. And so that's something that we bring is, we want to put together a team that will augment, their baseline of this health system and make this a better hospital to the point where they can, again, they'll still need us, to somewhat, but, in effect, we're working ourselves out of a job, but I'm happy to do, and again, because if we're making this kind of impact, that's positive for both the health systems, for the patients, for the physicians, and ourselves, then this is, really a good thing that we're doing.
Absolutely. It sounds like you found that unique edge too to like really speak to them, because like it sounds like most people are just like fill a gap, but you're actually like, you know what, I want to actually understand your issue and figure out why do you have a gap. And
Well, and I think, yeah, no, and absolutely, and that's that's part of it. And health system administrators, are very good at running hospitals, and it's I think not practical for them to be experts in every aspect of healthcare. And, we've been practicing, and I think, for us as physicians, that we can come in and say, hey, oh, we want a cardiothoracic program. Well, it's more than just hiring, a cardiothoracic surgeon. You know, who are your cardiologists? Where's the patient population? Things that we can almost as consultants say, if you want this to be successful, this is how you have to build this, right? And one of the things that we've noticed is that, when you're being paid to give advice, people listen. When it's free, they don't really take it. So their own physicians may be telling them the same thing, and they don't listen. They're like, oh, well, they work for us, so why should I listen to them? And sometimes you need that third party to come in to shake them a little bit and be like, hey guys, like, look, these guys are telling you, what's correct here is there's a method to building, sustainable programs. And it's not just by adding one or two things here that you may have to have a much bigger, take a step back, and have a much bigger view of what you want to accomplish and really, feed the health of that hospital, keep it in business, keep people employed. And again, in rural America, one of the things my group met with Kevin Stansberry, who is CEO of Lincoln Health in Hugo, Colorado. And, he said a very profound thing is that, rural America, that's where our food comes from. That's where our energy comes from. It's very important, to keep rural hospitals healthy. And I think he's completely right. These people deserve access to care, to cutting edge care. And, we're really excited that, it's something that we want to do is just to help people, achieve that goal.
Yeah, absolutely. And then now that you've been making like a lot of like headway in this area and your approach, are there pain points that you're running into in your own operations right now that you're trying to work through?
Yeah. So,
Yeah,
I say the number one pain point is time.
time.
And any physician would tell you that. I'm still working full time as a physician, in private practice and doing locums. So I wish I had more time. I again, we're a startup, so we're at the point we're not pulling money out. Everything that we make goes back into the company, and so I'd say I am lucky that I have two people that help us who are amazing at what they do, and that's helped a lot. So that's probably the number one pain point. I think number two is convincing the health systems that we can help them. I think locums compared to hiring a physician, paying physician a fair market value, as it were, it's more expensive. And when we get, health system people who just focus on, hey, this is really expensive and I'd rather hire someone. And, so the hard part for me is, for all of us, my partners, is getting them past that point to say, you have to look at this as an investment, right? When, things aren't going right, you have to spend a little bit of money, to get yourself in a better place. And I think that's true universally, across all businesses. And it's them having the willingness. And I think too, there are, they have their own heuristic based off of their past experience with some of the bigger companies. There are over 200 locums companies, in this country, and some of the bigger players, charge a lot more. And so they get stuck in that. And so, for us to kind of say, hey, we're different, we're a little bit different company, we're not here to rip you off. We want to see you successful because that is going to reflect on us and you'll use us again. And that's kind of where the point we are. We're not trying to, squeeze huge margins out of every deal we do. We want to build a reputation and build a company.
Absolutely. Build a rapport with the hospital or that group that you're working with, which makes a lot of sense. So yeah, for sure. And then like, what does the process look like too when you're working with like a potential, client? Like, what does the intake look like? The whole process. Just curious, like how do you work with your potential clients to set them up for success?
Well, what we found is that, personal relationships are very important. And for us, what we try and do is get in front of, the decision makers, which is really important. So whether, a lot of times that's the chief medical officer, sometimes in the bigger systems, it's somebody below them who's, head of locums, but really getting in front of someone physically, is important. Driving out to these hospitals, the three of us will get in a car and commute out there and sit in front of them. And I think it has much more impact than a phone call to show them, and be able to kind of discuss this is our process. This is what, this is our vision. This is how we want to help you. This is how we want to partner with you. And I think that's been, important. And it's the same thing with physicians. If you talk to any physician, I don't care who they are, they've received emails, texts, phone calls from recruiters for Locum Tenens. And it's a shotgun approach, right? I mean, we use the same systems like SendGrid and Twilio to, kind of mass shotgun text or email people. But, I think it comes down to when you get on the phone, again, we're a small company, you talk to one of the owners, and the same thing, with the health systems, you're talking to someone, that understands your language. When we talk to physicians, and I can say, hey, this is my personal experience. I've done locums. I know what to ask. When they say, again, when an anesthesiologist calls me, and talks to me, I know what questions that they're going to ask me. What kind of they're going to say, ask me, what kind of cases am I doing? Do I have to do OB call and put in epidurals? How much time do I spend in the GI lab? And really we can tailor it and see, is this the right position for them? Things that they feel more comfortable too. I've had physicians tell me, say, you know what, Kian, I wouldn't be considering this if I weren't working with you. If one of the bigger companies called me and it was a salesperson, I would be suspicious. I trust that you're going to look out for my best interest. And
Yeah.
so, I think that's what we're trying to lean into is that we are we are physicians, we understand, and we get, again, I understand being away from home. I have a wife, I have kids, so I can talk to them about what it's like, to be away for 4 or 5 days at a time, and that impact on the family,
Yeah.
and more personal issues. So those are things that I think set us apart.
Yeah, absolutely. You said that too, where they said to you specifically, like, if it weren't you, they wouldn't be going further, which is, I think, is a big call to like you, like it's physician owned, clinician back. That's like a big, not really a buzzword, but that's something that's really resonated with people when they are trying to find companies to look for. So that's definitely a big, appealing aspect of your company.
Well, and one of the things too is it's hard to make that leap. Really, to change what you're doing takes a lot of mental flexibility. And this is something that, with the advent of AI, we keep hearing is the people who are going to do well are the people who have this ability to have a mental flexibility of how they work. And what we've seen with a lot of people is they're afraid just because they don't know. And, and again, medical school is woefully deficient in teaching us anything about economics, business practices, anything. Even when I remember finding my first job, I'd ask my mentors, I'm like, hey, what do you think of this job? And they're like, yeah, it's okay. Yeah. All right. Yeah. You should just sign it. And I'm like, well, do I need, what does this mean in the contract? Do I need to, and most of us learn through experience by making mistakes. And, uh, we're like, oh, I should, again, we don't know what's a good deal. There's no educational platform. And so that's something that we would like to expand on, through, blog posts, podcasts, things like that, is teaching physicians, you know, about the economics of practicing and looking at this because some people are afraid even because if you do locums full time as I say, so when you do locums you're an independent contractor, so you're 1099, you're not a W-2 employee, so you have to figure out uh, benefits on your own. So healthcare, dental, vision for your family. But that's enough to scare people away. Like, I don't know how to do that. Do I want to spend my weekend, on Google trying to figure out how do I buy, you know, and again, if we can create, and so some of my partners are working on this, is to create, some primers on, this is how you form an LLC. If you all do I have to call an attorney? Like, no, for most cases, in the state of Colorado, if you want to form an LLC, it takes about 10 minutes and $10. And you can set it up so that you can have the benefits, of running the money through an LLC. Here's someone, maybe, we want to find, identify some insurance brokers that can help you buy stuff on the open market. If you need health insurance, just different things that, we can get people, because I think it's some of the more entrepreneurial people that have figured that out, that are go-getters, that get that. And a lot of people are just like, what breaks my heart is to see these people who are in situations where they're just like, I hate working for, so and so. Well, why don't you leave? Why don't you do something about that? Well, it's just too hard. I've got a steady salary, I have benefits, this. And, for us, it's how do you get people to that point where you're like, there's a better life. And, I had one of our clients, said, she's an anesthesiologist. She's like, hey, if you're an anesthesiologist and you're not doing locums now, you're missing out. It doesn't make sense because that's one of the highest needs across the country. And we've just seen in different pockets, like places like Billings, Montana, Des Moines, Iowa, Memphis, Tennessee, where, anesthesia's kind of been devastated because of multiple different factors. And people have left the community. So there's lots of opportunities for them to go to these places and make good money, have better control over their life. Because one of the things that we hate is, Becker's just had a recent article that it's becoming nationwide, becoming hard to convince physicians to take leadership positions within the hospital. And, and this article went through different, reasons why, and, gave, how do we change this? And it was interesting because it was about empowering physicians and nothing. And I went to the comments, and the top 10 comments are like, why don't you pay them? So it was just like a simple thing. Like, you're asking them to give hours away from their practice, from their family. Are you compensating for that? Are you, if you're employed, are you giving them RVU credits, to be part of, healthcare leadership? And that wasn't addressed at all in the article, which I think was a huge flaw. But you saw the physicians were like, pay me. Like, pay us for our time. Nobody else works in the hospital for free. And, on the administrative side. So, give us, if you want us to build these programs, some people even talked about, I'm going to build this up for the hospital, but then the C-suites are the ones that get, when I build up this great program, they're the ones that get the bonus.
Right.
I'm not the, I have a salary, but there's no bonus structure. If I hit some very high volume goals, but nothing's rewarded for actually building the program, the administrative time that you put into that. So, this is where I think we need to kind of shift the paradigm, that we figure out, hey, how do we make this better, for physicians, where they like to work and they feel that they're well compensated. They feel like they have enough autonomy to make decisions about when they work, when they don't work, and, live their life, better, happier, and one of the things that really, we've seen is, compared to our cohorts in different industries, that typically in most industries, when you get older, you work a little less, you make a little more.
Yeah.
And for most of us, that we've seen is we're working more and we're making less, as we get older. So something needs to change, especially if we want to keep having, the best and brightest, American students go into medicine, which is very important, to keep that going, and not create a kind of crisis in this country.
Absolutely. And then it's like kind of looking at your company too, are there like specific KPIs or metrics you're using to measure your success early on here? And as far as like where you're evaluating, like where you're doing really well, or maybe there's opportunities to grow from the alternative perspective.
Yeah, so there's kind of two sides to this industry, and one is getting access to the jobs. And so one of the things that we've had to kind of navigate are, there are some health systems that you can negotiate with directly, but a lot of them are on a vendor management service or managed service provider network. And there's pluses and minuses to that. I don't think overall it's a great thing. I think it adds another layer to it, which can be difficult. Some of the vendor management services are what we call vendor neutral. That means that everyone has access to the jobs. Some of them are tiered, meaning only the big companies get first bite of the apple, and it only comes down to our tier if the big companies can't fill the job. It's a cost for us as well, because one of the things that we have to um, consider is, is it worth, the amount of money that we have to pay to subscribe? Some of them are free, some of them take a percentage, some of them are subscription model where, we pay to get access to the jobs. So I think, that's one of the, things we're trying to, navigate as a smaller company is, when do we make the leap to the next, platform that we can afford. The other thing is access to the physicians. Most of the physicians that we've placed so far are through connections. Either direct, friends or friends of friends. There are some things available which give you access to physicians who want to do locums. So looking at our conversion rate, is one of the KPIs that, I think we follow is, how much time do we spend, talking to someone? Will they actually do a shift, for us or not? And I think we're very early in the process. We don't have a ton of data right now to, really act on it and change. And, what we're trying to do is sort of grow organically. We're going to get we're not at that point yet where we're going to have to make a decision, about, do we bring in a whole lot more capital, either through a loan or other investors to really expand, and when do we get to that point? That's something that, I think we're a bit away from in looking at, our goals, because right now I think we're focusing on that personal approach, that boutique service that we're providing to try and get people placed.
Yeah, absolutely. And that makes sense for you too. Is like, that's like your whole unique stance is like you build the rapport, you take the time to do that, and you're focusing on quality over quantity of people that you're working with. is what it really sounds like too. So
Yeah, and again, my partners were very aligned in what we want to do because we do. I think the quality component I think is very important, and we're more interested, like I said, in building a reputation and having happy customers, on both sides, both the providers and the health systems that say, "Hey, I really enjoyed working with these guys. Look what a difference they made. This was awesome," and grow organically, and that's kind of what we want to do.
absolutely. And like if you had, a vision right now, might be kind of far to think in the future. Like in 6 to 12 months, what does success look like for you guys?
I think developing, I've talked to people in the locums industry and a lot of, the smaller locums companies, it's developing a really good rapport with just a few health systems. Instead of placing one person here, one person there, to find, a health system that, understands our value add, our quality, and then wants to just work with us. And I think that's really what our goal is to find, at the start, one or two systems that want to use us, for as much as they can. And I think that's our goal to kind of being sustainable as a company and is, instead of, I place someone in Maine, here, California, Oregon, Idaho, one person here, one person there. It's that, hey, here's a health system, in Colorado, and they've got some rural hospitals, and let's focus on seeing if we can become, their provider, their preferred provider for these things that, we're getting a phone call saying, hey, what can you help? Can you help us with this? And that's sort of our goal in the next, I would say 6 to 12 months, is to get one or two of these health systems that want to use us, exclusively
Yeah.
if they can.
Yeah, that's a realistic goal for sure. Especially in this market, we're trying to, like you said, you're small. You got to compete with the bigger companies that have been doing it a lot longer, and it's almost a transformational change in those discussions and getting, health hospital administrators to think in a different way they may not have thought of before. But you can show your value add there, like you said. And then, is there anything soon that you guys are trying to figure out, you're trying to tackle right now that you haven't been able to, solve?
Well, I think one of the things, being a small company is how much marketing, we want to do. So again, you and I met through LinkedIn, and that's something that we kind of started and realizing this is very important through, this process of social media, online platforms to, get our message out. And, that's something like in the immediate future that we want to do is how do we get this message? I think we have this great plan, but right, there's a consultant once told me there's a graveyard of great ideas, and it's really down to execution. And how can we start executing that we can start realizing, our vision, and that's the important part. And so I think part of that is figuring out, the marketing and giving us, spending enough time, like again, that's the important thing is that I started to kind of pare down my private practice and, so that I can devote a little bit more time, and all of us are trying to carve out time here and there where we can really work on these things. And, and that's the biggest thing holding us back is that time commitment. But we all have families, mortgages, kids in school. So, for us, it's something that we just have to deal with. We understand that means a little bit slower growth, but something we're willing to, stick in for the long haul.
Absolutely, for sure. And I really appreciate your time today, and sharing your insights and what you're trying to do, with your company. It's a really, I'm sure very fulfilling mission that you're on, and a very unique perspective to take when you're working with the hospital. So I'd really appreciate it. And where can people find you? If they want to engage with you, with the audience
Well,
today.
our website, www.provideronesolutions.com, all one
Okay.
word. We have a website that you can contact us through there. Again, we're the three of us, the owners, we're all on LinkedIn, social media. Again, I'm not shy about giving my cell phone number to anybody who wants it. So I'm happy, again, I'm happy to talk to anybody. And
Yeah.
that we kind of, we're hungry in that aspect, that we really, we tell each other all the time, the worst thing that can happen is someone says no, and no big deal. And so, yeah, visit our website. We have jobs posted there, but, just some of the hotter jobs that we're trying to, but we have access to a whole lot more. And even if they visit us, get in contact with us, fill out an application. We
Yeah.
may not have a job right away, but we'd love to work with you and find something that eventually fits you, and puts you in that position to, you know, curate your practice and, have a more fulfilling medical career.
Yeah, absolutely. Well, thank you today, and wonderful having you on the show.
Yeah, no, John, thank you so much. I appreciate you reaching out and letting me express our vision here. I'm very grateful. Thank you.
Absolutely. Thank you.